Hello, I'm Dr. Booth Danesh, physician and gastroenterologist in Britain. I'm a cancer sufferer. I was diagnosed just less than 10 years ago that I had non-Hodgkin lymphoma in my left pelvis and had metastasized to my abdominal lymph nodes, to my groin, and had affected my pelvis. My pelvis was on that side totally infiltrated by the cancer. I had a great deal of pain, and as I treated everybody else for cancer with conventional methods, but I had a holistic approach in my practice always. However, I received chemotherapy. They could not take my tumor out, and also I had radiotherapy, and I had also spinal exploration, which gave me neuropathy from which I'm still suffering. The side effects of my chemotherapy, which included CHOP and rituximab, resulted in generalized weakness. I was 8 months in hospital, in bed, and when I recovered, or I could say not fully recovered, but I was in remission, they were discharging me from hospital, from Center of Excellence in Britain, and I was left basically on my own to find my own ways. During my treatment while I was in hospital, I was very fortunate that I had a lot of support, spiritual support and diet support from friends, and meditation and other aspects of holistic and naturopathic therapy. When I got home, it was a very difficult period for me, because throughout I was taking a normal diet, even though I had sensitivity to lentils, which developed just before diagnosis of my cancer. For example, in the hospital they were giving me lentil soup, which obviously I didn't take for the risk of having anaphylaxis shock. So my diet, it was very hard to monitor it very well. I took the diet which I thought it was right for me. I had some general knowledge from my research that the pH was important in our body, how to basically to keep to a diet that is not too acidic, but it was, I have to admit, it was extremely difficult to monitor myself. As my symptoms didn't improve and is getting worse, with joint pains, with tiredness, excessive tiredness. After meals, I have to lie down for a couple of hours, with abdominal problems, of bloating, of pain. And I came across Dr. Young's foundation, and I felt I should come and both learn and recuperate from the problems which I have. My purpose is to be able to get rid of my pains, to be able to sleep better, and to stick to a proper diet in a holistic environment. This is my 3rd day here, and I feel very strongly that this is the right environment I have chosen to be treated in a holistic and therapeutic way. I'm having daily massages, first class and best massages I have had, very much in an anatomical and physiological way, which has helped me. I can maintain now a straight posture, which I couldn't. I am receiving also colonic irrigation, which makes me feel good afterward. And I am on a special diet, which is mostly liquids and greens and no sugars. As a doctor and as a physician and as a gastroenterologist, I'm very much aware that diet is very, very important in our health. And I feel that in this environment, I'm receiving the right treatment, what I was looking for. Because there are other places that one could go, and in farms and so on in Britain and elsewhere, that one could be relaxing in a spa, etc. But I find this place is extremely a special one. And I feel privileged that Dr. Yang has accepted me to come into the program.